Hi everyone, and welcome back to the MS Workouts channel. Let's talk about knee pain and hyperextension. We've been seeing a few comments around the YouTube channel asking us for help in improving your knee stability so that you can have less pain, hyperextension, and buckling in the knee. So what we're going to do this week is guide you through the best exercises that can help strengthen your quadriceps and hamstrings, i.e. the muscles that support and surround the knee, from a lying position so that you can execute these from the bed and or the couch. Much easier to access them, okay, than the typical exercises from a seated or standing position. The cool thing is that you're going to go slow through these exercises, and it's going to allow you to strengthen the areas around the knee without actually irritating the knee joint. No forces whatsoever. So it's a win-win. It's effective and it's safe. Remember that your knees didn't hyperextend overnight, and they will not repair themselves overnight. But if you deploy these exercise sets 1 to 3 times per week with proper intensity and recovery, which comes along with proper nutrition, okay, you will see that knee pain and hyperextension will almost disappear because of the development of the muscle tissue around the area. All you're going to need for today's exercise is simply a place to lay down, a progress journal that you can download in the description box below, and your very best effort. If you have resistance, then please go ahead and bring it along to the video, because you can add that to the quadricep and hamstring in your hips. I'll show you on the bridge, one of the exercises we get to, because that's gonna help supercharge your results. Remember that we need to increase the intensity and make sure it's challenging over a period of time to see the results, okay? Now, if you do not have resistance, it's perfectly okay. Just allow yourself to follow me during these exercises as I demonstrate them. And also, please do not forget to hit the subscribe button, turn on the notifications so you can be notified when our latest videos drop, and leave us a like after the video if you enjoyed it. All right, are you ready to tend to these knees? Let's go. Welcome back everyone, and thank you for joining me for this exercise session here to focus on improving strength in your legs, right? To reduce knee pain, hyperextension, and buckling. As I mentioned before, you want to make sure you have an area to lie down, that it's nice and safe and soft. Make sure you turn on the air conditioner, have some water close by so we can keep that central nervous system under control, and bring your best effort. Let's go ahead and rock this. All right, I'm gonna head down to the floor, and we're gonna execute 3 different exercises. I'm gonna go unilateral with these, meaning we're gonna go one side at a time, but I do want you to execute these on both sides, okay? There is what's called a carryover effect. We do have a tendency to want to execute them on one side versus the other, right? Just our weak side, but go ahead and execute them on both. The first exercise is going to be what we would call heel slide, and it is going to be primarily focusing on hamstring, but also it's going to be targeting the quadricep as well as you extend that knee out. And it's actually working both the anterior and posterior side that support that knee. So this is a great exercise to get blood flow and start stimulating change. If you want to add resistance, you can always strap that to the bottom of the foot as you extend through the range of motion to really make sure you're challenging the muscle tissue, because the goal is to reach momentary muscle failure, get the intensity as high as possible to truly prompt change. If you don't have any, like I don't worry about it, just follow along. You can add some after you complete it and execute it again. All right, let's go ahead and rock and roll. Starting position, we're going to extend right leg straight down. We're targeting left side. I want you to bend knee, okay? Heel flat. Clock is on. We're gonna initiate movement out slowly, and you're thinking about squeezing quadricep as you extend knee, right? You're gonna pause, don't relax, and slowly head back in. Dragging heel as you come to full flexion of the knee. We're targeting hamstring as you come in. I want you to flex at full flexion and head back out. Momentary muscle failure is the goal. That's simply the point. You can no longer continue with fully contracted proper form. When you get to that point, notate the time that's on the clock. Simply give yourself enough time to recover momentarily, then jump back in. When you finish the exercise set, then you're going to record the time that you successfully reached muscle failure, right? Heading back in. All right, we're going past the 45-second mark with this effort here. Remind yourself why you are doing this, right? We want to strengthen the knee. We want less buckling, hyperextension, and in order to get that, you have to strengthen the muscle tissue around the area. Heading past that 60-second mark with this next effort into what we call the exhaust range. That's the final 30 seconds of the exercise, and where you should reach momentary muscle failure if it's an appropriate enough intensity to prompt the best mechanical and metabolic results. As you come in, you should be starting to fatigue. You may be feeling this in your hip flexor too as well. That's perfectly fine. Squeeze at full flexion heading back out. Let's go one more final opportunity to reach momentary muscle failure. At the end point, you're gonna pause, head back in, dig that heel in, right? Hamstring engaging for 3, 2, and slowly disengaging. I completed the set. I made it all the way to the 130 mark, so I need to increase the difficulty now, okay? Increasing the difficulty means adding resistance, because if you complete the entirety of the set, your muscles are proficient. And the way that you prompt the very best results is to challenge them at a level so that they know that they're not proficient at that given load and output, and they need to get stronger. Next exercise, we're going to target the quadricep in a lying position. So now we're going solely to the anterior side. We're going to execute an isometric, what we call metabolic set. Go ahead and follow me to the starting position. All right, we're going to go ahead and lie all the way down. Now, we are going to stay on the left side. As I mentioned, you will circle back around once you execute all 3 of these and hit them on the right side as well. Super important exercise both sides. All right, so this quadricep focused isometric set, the goal is the same. We're trying to reach muscle failure. We want you to lie flat here. You're going to extend your left leg all the way up. If you need to use a band or a towel to help extend up, please feel free to do so. Clock is on. You're squeezing quadricep. If again, you need a towel, a band, something to help elevate the leg, please feel free to do so. You could also put an ottoman underneath your leg here and think about trying to lift that leg up. Most important thing is to try to extend the knee as much as possible, squeeze quadricep. The higher you have the leg here, okay, the less resistance is into the quadricep. The lower you have the leg here, the more resistance is into the quadricep and hip flexor, okay? Locking knee out, and again, looking for muscle failure. Muscle failure is simply the point you can no longer stay in this starting position, right? The muscle has to relax. We want to get to that point during this exercise set to clearly communicate a high enough intensity to prompt results in the recovery process. Now, it is uncomfortable, right? We're feeling a deep burn. That is a good thing. You simply give your best effort and remind yourself why you're doing this. The benefits here going to help increase stability into the knees, right? Reduce hyper extension, immobility in the knees, and strengthen that lower body so you don't have the ache and pain in the knee that you would once you have atrophy in the muscle tissue. We're reversing that, right? Okay, as you can tell on the clock, we're already in the exhaust range, which is that last 30 seconds. So if this is an appropriate difficulty to prompt the best results, you should be getting close to muscle failure. Notice I'm shaking, right? Rattling, rolling. That's my neurological and mechanical muscles just starting to get close to failure. That's a good thing, not a bad thing. No more than 3 seconds, 2 seconds. Whew, I did it. Successfully exhausted right at that 130 mark. If it was before the 130 mark, I would jump back in, right, and continue on for the remainder. Alrighty, I reached momentary muscle failure. I successfully did it. And what that basically means is the next time I execute this strength training exercise, I don't need to increase the difficulty. I need to allow my body to fully recover. And then the next time I execute that metabolic leg extension set, my aim is to complete the exercise or get further than I did that time. That's going to show me that I'm seeing improvement in the actual output of that muscle. All right, we're gonna go ahead and execute one more exercise here, and now we're shifting the focus back to the posterior side, the hamstring, okay? So hamstring, a little bit of glute as well, but this is gonna help shore up the posterior side of that knee so we can really combat that achiness and or hyperextension in the knee. Let's go ahead and rock it. Okay, so we're going to execute what we call an eccentric set. So in order for this to be a true eccentric accentuated set, we really need to overload the body, okay? So if you have some type of resistance, I'd like you to add it to your hips, whether that's a dumbbell, whether it's a weighted vest, whether it's your cat, your dog, a bunch of books, whatever resistance you can add it to your hips, because we want to really make sure we are overloading and challenging the lengthening of the muscle tissue during this set, okay? All right, just go ahead and follow along with me. We're gonna go to the starting position. You're gonna press through your heels. Notice my legs are bent. You're going to elevate hips all the way up into the air, squeeze glutes, clock is on. We're gonna start by holding for 2 seconds, squeezing glutes, flaring knees. Now slowly lower the hips, 10 seconds or slower. Now, if you don't have resistance, you shouldn't be sitting on the sideline right now, okay? Just because you don't have resistance, that's okay. You go ahead and jump in, do it without resistance. Next time, once you prove that you can do it without reaching muscle failure, relax the bottom, follow me all the way up, then you can add resistance next time. Squeeze and hold the top for 2, 1, now you're slowly lowering. Now these eccentric efforts, Muscle failure is success, and the way it expresses itself is when you can no longer lower at 10 seconds or slower, okay? That's success. Relax for 2, 1, all the way back up. Notice we are relaxing between each of these efforts, okay? Squeezing the glutes, flaring the knees, heading down. We're going past the 45-second mark with this next effort. This is, again, really good for the posterior side. If your hamstring cramps during it, just extend that leg out, jump back in with us. Relaxing for 2, 1, back up. Going past 60 seconds with this one, squeeze the top. Now slow on the way down. Notice I'm going extremely slow on this lowering. This is the lengthening of the muscle, right? As we pass that 60-second mark, we're heading into the exhaust range. Relax for 2, 1. All right, we're back up. Less than 30 seconds left for 2, 1. This effort's taking us past the 115 mark. Again, reminding you, muscle failure is the goal. That's the point where you can't lower it 10 seconds or slower anymore, right? You're not able to control it. All right, last step. We're gonna go past the 130 mark here. Squeeze the top for 2, 1. Now, as slow as you can on the way down. You should feel a deep burn in the hamstring glutes. Rounding it out in 3, 2, and 1. Oh, completed. So I was able to complete the entirety of the set. I was able to lower at 10 seconds or slower every single one of those. So what that basically means is that although it might have been challenging, I wasn't truly challenging my muscle at the intensity that's going to give me the best results in reducing the instability in my knees. So what I need to do next time is I need to increase the difficulty. And the only way I'm going to remember that is if I write it down in my progress journal. So I'm going to write 130. I'm going to write plus, right? Meaning I need to increase the resistance or difficulty next time. And that way I know when I come back and circle around and do these after I've recovered, right? We need some active rest days after this. Then I can add the resistance that my body truly needs to progressively continue to see results, because that's what exercise is really all about. A progressive overload followed by a fully recovered system, and then you reapply. If you like this video, don't hesitate, okay? Give us a like. We really hope that you're able to utilize these in a manner that allows you to strengthen your knees. You will. If you execute these 1 to 3 times per week on both sides, focus on your recovery, your adequate protein levels, right? Your active rest modalities. And if you're not sure what active rest modalities are, jump over to msworkouts.com. Okay, we have over 140 movement drills and active rest modalities, not to mention yoga classes, stretch classes, and a lot of guidance that gives you specificity around the symptoms you're looking to reduce on your active rest days between your exercise sessions, okay? So you have something to do to positively work towards your goals 7 days a week, okay? Hit the notifications button so you can be notified when our latest video drops. Leave us a comment so we can engage with you and help you on your journey. And last but not least, thank you so much for joining me today, and I look forward to seeing you next week. Take care. Our YouTube channel is a great place to start gaining strength, but if you want to get serious about reducing your symptoms and getting results, then you need to be on a weekly structured strength training program with other individuals just like you. And that's exactly what we offer at MS Workouts through our membership. Click the link in the video or below the video to learn how our membership can help you achieve your goals. And while you're on the website, make sure you sign up for the no-cost 7-day strength camp so you can experience how we can help you do the things that you love to do with more confidence. See you all next week.